Minoxidil is not a quick fix. Minoxidil needs to be applied directly to the scalp. Remember, minoxidil does not block DHT. Minoxidil is a safe and effective treatment for the right patient when used correctly and with realistic expectations. Minoxidil is one of the most widely used hair loss treatments in the world. You can buy it at any drugstore. You've probably seen it advertised everywhere. And chances are, if you're dealing with hair loss, someone has already told you to try it. But here's the problem. Most people start using minoxidil with almost no real information about how it actually works, what to expect, and what can go wrong. Today, I'm giving you the 10 things that nobody tells you about minoxidil. The stuff that doesn't make it onto the box, that your doctor may not have had time to explain, and that could make the difference between this treatment working for you or giving up on it too soon. So let's get into it. Before we get into the list, I want to give you a quick foundation because understanding what minoxidil actually is will make everything else make more sense. So minoxidil was originally developed as an oral medication for high blood pressure. During clinical trials, researchers noticed something unexpected. Patients were growing hair in places they hadn't had it before. That side effect became the product. It was reformulated as a topical treatment and approved by the FDA for hair loss in the 1980s, first for men, then for women. So how does it work? Minoxidil is a vasodilator, which means it widens blood vessels and increases blood flow to the hair follicle. That improved circulation delivers more oxygen and nutrients to the follicle, which prolongs the growth phase of the hair cycle and can reactivate follicles that have become dormant. It does not block DHT, the hormone responsible for androgenetic alopecia, which is an important distinction we'll come back to. Today, it's available as a topical solution or foam at 2% and 5% concentrations, and more recently as a low-dose oral tablet. It's one of only 2 FDA-approved treatments for hair loss, the other being finasteride. So with that foundation in place, let's get into the 10 things no one tells you. Number 1, the shedding at the beginning is normal, and most people quit because of it. This is the number 1 reason people stop using minoxidil too early, and it's completely avoidable if you know what to expect. When you first start minoxidil, many people experience an increase in shedding, sometimes significant, in the first 4 to 8 weeks. This is called minoxidil-induced telogen effluvium, and it's actually a sign that the treatment is working. Here's what's actually happening. Minoxidil pushes dormant hairs that are sitting in a resting phase out of the follicle so that new, healthier hairs can grow in their place. You're essentially clearing the runway. The shedding is temporary, and it typically resolves within 2 to 3 months. But because no one warns patients about this, they see more hair in the shower, panic, and stop using it right before it would have started working. If you're in the early shedding phase, stay the course. Number 2, it takes at least 4 to 6 months to see real results, possibly longer. Minoxidil is not a quick fix. Hair growth is slow. The hair cycle operates on a timeline of months, not weeks. So most patients start to see meaningful regrowth between 4 and 6 months of consistent use. Some don't see their best results until the 12-month mark. So if you're evaluating minoxidil at 6 weeks and deciding it doesn't work, you've not given it a fair trial. Commit to at least 6 months of daily consistent use before drawing any conclusions. Number 3, if you stop using it, you'll lose the hair you gained. Well, this is the one that catches people off guard the most. Minoxidil doesn't fix the underlying cause of hair loss, it just manages it. The moment you stop using it, the hair follicles that were supported by the treatment will return to their previous state. So within 3 to 6 months of stopping, most of their regrowth will be lost. This is a long-term commitment. If you're not prepared to use it indefinitely, it's worth having a conversation with your dermatologist about whether it's the right treatment for your situation or whether combining it with something that addresses the root cause makes more sense. Number 4, the 5% formula is not just for men. For a long time, the 5% concentration was marketed exclusively to men, and women were directed to the 2% formula. The reality is that many dermatologists, myself included, use the 5% concentration in female patients, particularly the foam formulation because it's more effective. The foam also tends to cause less scalp irritation and is less likely to cause unwanted facial hair growth compared to the liquid solution. So if you're a woman starting the 2% and not seeing results, talk to your dermatologist about whether the 5% foam is appropriate for you. Number 5, where you apply it matters enormously. Minoxidil needs to be applied directly to the scalp, not to the hair. I cannot tell you how many patients come in and tell me they've been applying it to their hair and wondering why it's not working. The active ingredient needs to reach the scalp and to be absorbed into the skin to get to the follicle. So part your hair, apply it directly to the areas of thinning or loss, and massage it in gently. Let it dry completely before styling. If you're using the liquid formula, be careful about it running onto your forehead or face because that can cause unwanted hair growth in those areas. Number 6, it works better on some types of hair loss than others. Minoxidil is most effective for androgenetic alopecia, the pattern hair loss that is genetically driven. It's also used for alopecia areata and some other forms of hair loss, but with varying results. It's generally less effective for hair loss caused by nutritional deficiencies or thyroid dysfunction or scarring alopecia. This is why getting a proper diagnosis before starting treatment is so important. If the underlying cause of your hair loss is not androgenetic alopecia, minoxidil might not be the right first-line treatment, and you could spend months using it without addressing what's actually going on. Number 7, oral minoxidil is a game changer, but it comes with considerations. Low-dose oral minoxidil, typically 0.625 milligrams to 2.5 milligrams daily, has become increasingly popular in dermatology over the last several years, and the results in clinical studies have been impressive. Many patients who didn't respond well to topical minoxidil have seen significant improvement with the oral form. However, because it's a systemic medication, it does come with potential side effects. The most common being fluid retention, a drop in blood pressure, and hypertrichosis, which means unwanted hair growth on the body and face. It's not appropriate for everyone and it requires a prescription and monitoring, but for the right patient, it can be remarkably effective. And let me just caution you on prescribing it to yourself online. There are a number of online pharmacies and platforms that will prescribe minoxidil to you, but it's really not recommended to do it that way. It's important to come into a board-certified dermatologist, have a thorough consultation, and make sure that it's appropriate for you specifically with your health history. Number 8, it works best when combined with other treatments. Minoxidil is a strong tool, but it's rarely the most effective approach on its own, especially for androgenetic alopecia. Remember, minoxidil does not block DHT. For patients with pattern hair loss, combining minoxidil with a DHT blocker like finasteride or an androgen receptor blocker like spironolactone addresses the hormonal driver of hair loss, while minoxidil really supports regrowth. In-office treatments like microneedling and PRP can also significantly enhance minoxidil's effectiveness by improving scalp circulation and follicle health. So if you've been using minoxidil alone for a year and results have plateaued, a combination approach is worth discussing with your dermatologist. Number 9, scalp health matters more than most people realize. Minoxidil works at the level of the follicle, and if your scalp environment is compromised, the treatment's effectiveness is going to be limited. Chronic scalp inflammation, seborrheic dermatitis, product buildup, and poor scalp circulation can all interfere with follicle health and minoxidil absorption. I always tell my patients, treat your scalp like skin, because it is skin. Keep it clean, address any inflammation or dandruff, and consider a scalp-specific routine alongside your minoxidil use. A healthy scalp is the foundation everything else builds on. Number 10, earlier is always better. This is probably the most important thing I want you to take away from this entire video. Minoxidil and hair loss treatment in general is significantly more effective when started early. Once a follicle has been dormant for too long, it can become permanently miniaturized and unable to produce a terminal hair. Now, minoxidil can reactivate dormant follicles, but it can't resurrect dead ones. So if you're noticing thinning, shedding, or widening part, do not wait. Do not tell yourself it'll get better on its own. Come in and see a dermatologist. The earlier we intervene, the more we have to work with. Before I wrap up, I want to quickly address who minoxidil is and isn't appropriate for. because it's not right for everyone. Minoxidil is generally appropriate for adults experiencing androgenetic alopecia, diffuse thinning, or other forms of non-scarring hair loss. It's not recommended during pregnancy, or if you're pregnant or planning to become pregnant, please speak with your dermatologist before using any form of minoxidil. People with certain cardiovascular conditions should also use caution, particularly with the oral form. And if you have a sensitive or reactive scalp, the liquid formulation might cause irritation, so the foam is better tolerated. The bottom line, minoxidil is a safe and effective treatment for the right patient when used correctly and with realistic expectations. But safe and available over the counter doesn't mean appropriate for everyone without guidance. A dermatologist can address your specific type of hair loss, rule out underlying causes, and build a treatment plan that actually addresses what is happening, not just what you can grab off the shelf. Hair loss is one of the most emotionally charged things I see in my practice. It affects confidence, identity, and quality of life in a very real way. And minoxidil, when used correctly with the right expectations, can be a genuinely life-changing treatment for a lot of people. To recap, the 10 things no one tells you. The early shedding is normal and temporary. Results take at least 4 to 6 months. Stopping means losing your progress. The 5% formula is not just for men. Application technique matters. It works better for some types of hair loss than others. Oral minoxidil is a powerful option. Combination therapy is often more effective. Scalp health is foundational, and earlier treatment always wins. If you're dealing with hair loss and you've been putting off doing something about it, please don't wait. The sooner you act, the more options you have. Give this video a like if it was helpful and subscribe for more content like this every week. Leave your questions in the comments. I read every single one. I'll see you in the next one.